Today, we're diving into an important topic that many of us don't usually consider: the cognitive effects of medications. It's a vital area of study to understand the broader impact of the drugs we consume on our overall health. Specifically, we're going to discuss the effects of a particularly common group of drugs called statins, often used to lower cholesterol. Now let's get into the meat of the subject: the cognitive impact of statins. Recent studies have shed light on the connection between these medications and cognitive functions. Two randomized trials designed to assess this correlation have shown a disturbing trend: a significant decline in cognitive function. This was further supported by a large case series involving 60 patients, which reported adverse effects on memory and cognitive function. These incidents occurred unexpectedly and vanished just as quickly. Let's put it into perspective. Imagine being on an airplane, flying high at 30,000 feet, and your pilot suddenly experiences statin-induced memory loss. Quite a terrifying prospect, don't you think? This is the reality that some individuals on statins face, but the potential impact of statins doesn't stop at cognitive function. In every study with rodents to date, statins have been linked to the development of cancer. While human studies have yet to show a similarly dramatic correlation, this could be due to the fact that cancer takes a long time to develop, while most statin trials do not go on for more than a few years. However, in one trial, the CARE trial, breast cancer rates in those taking a statin increased by 1,500%. In the heart protection study, non-melanoma skin cancer developed in 243 patients treated with simvastatin compared to 202 cases in the control group. It's worth noting that manufacturers of statin drugs recognize that statins can depress the immune system, potentially leading to cancer and infectious disease. Consider another case. A 49-year-old woman was admitted to the hospital with diarrhea and septic shock a month after beginning treatment with lovastatin. She sadly passed away after a prolonged hospitalization due to necrotizing pancreatitis. Her doctors noted that the patient had no evidence of common risk factors for acute pancreatitis. They warned that those prescribing statins should be aware of the possibility of acute pancreatitis in patients who develop abdominal pain within the first weeks of treatment. Lastly, several studies have noted a correlation of low cholesterol with depression, suicide, and violence. For instance, a study of over 29,000 men in Finland found that low cholesterol levels were associated with an increased risk of hospitalization due to depression and of death from suicide. Women with low cholesterol are twice as likely to suffer from depression and anxiety. In conclusion, while statins can be beneficial in managing high cholesterol levels, it's crucial to be aware of the potential risks associated with their use. From cognitive impairment to increased cancer risk, and even a link with mental health issues, the impact of these drugs goes beyond their intended function. It's a stark reminder of the importance of fully understanding the potential effects of our medications and the necessity of ongoing research and discussion within the medical community.